My name is Will Sillinger. I'm the Chief Operating Officer of Your Health. I've been with the company since 2012. So fee-for-service obviously is driven on volume. You see more patients, you get paid more. The introduction of value really brings in that clinical necessity, and then you merge it in with the fee-for-service, and that's how you essentially build this value model. Athena, with all the data and all the insights they give us, you really transform from how much can I bill to what can I do for this patient right now where I don't have to focus on, grinding out 40 patients a day. Let me go look at all the clinical insights on the quality tab of Athena. What can I do for this patient to promote the outcomes, as opposed to looking at this patient going, oh, it's a transaction, I need to go to the next patient. So you really, I would say fee for service is transaction based, and then value is more relational based healthcare, which is where it really needs to be. There's no end to fee for service. You just grind it out every day, and then, in November, they're gonna release the final rule and you take another pay cut. And so all these doctors traditionally wanna make a lot of money. It's not gonna be there in a couple of years because staff labor is getting much more expensive. So you have to see even more patients. And then you start looking at the quality outcomes. Well, is the provider in the right headspace after seeing 50 patients and you're the 51st patient today? No. But in the value side, you can see fewer patients with that care team approach with more people. The provider's happier, the patient's happier. And so I encourage everyone to go to value. It's very tricky, but once you have your patient population and you know who your patients are, the rewards are exponential because you're rewarded for great outcomes. Athena makes it very easy. With all the display of the quality metrics and everything, I don't know if other EMRs give you that much access. Y'all give providers access to do everything they need to at the point of care. And then you give them access to all the reporting on the back end so they can make sure that they're meeting certain measures and they can track their progress along the way. The trending y'all do within the patient chart for certain lab results and certain gaps in care is brilliant. Because a lot of providers, they can look at numbers, oh, that's going up or down. But once you put it on a graph and you put some colors to it, a lot of people look at that differently. I think Athena is very modern in their approach, as opposed to being, as I said earlier, out of the box product where it's just a documentation tool. Y'all have taken the concept of, yes, you can document in here, but here's all these other features we give you to advance the care of the patient. And I think it's brilliant.